Welcome to BRITE Connections. BRITE Connections is an interactive monthly series designed to bring together our community's youth with community supportive adult members. I'm Victoria Saig, Director of Performing Arts and Project Coordinator for BRITE, and also tonight's host. For those of you who may be new to BRITE, we are a nonprofit based out of Ventura, California, focused on promoting mental health and well-being through performance and the arts. Our mission is to support youth between the ages of 12 and 25 by helping to amplify their voices around issues that they care about. BRITE is made possible through funding from Ventura County Behavioral Health Department, Substance Use Services Prevention. Thank you for joining us tonight. I'm looking forward to spending the hour with you all. Tonight's interactive discussion will be around opioids. The statistics are rather grim. In the United States, 50,000 people die every year from opioid-related overdoses. 100 of those deaths occur here in Ventura County. Tonight's discussion will explore the theme of suicide and addiction, which some viewers might find distressing. Tonight, we'll also be fielding live questions and comments from you all. So if you're watching and able, we encourage you to ask questions and comment right here on this live video. As a general rule, the sooner you get those questions, the better, but we will be fielding questions the whole hour. Now, it is my pleasure to introduce you to the panel of experts participating in tonight's discussion. Catherine Casimir. Catherine is the founder and the executive director of our nonprofit organization, Reality Improv Connection, and our director for the BRITE program. She has been developing prevention education and engaging youth and young adults in advocacy projects since 1991. Hi, Catherine. Dr. Stacy Nelson-Hicks, after a career producing Western medical segments for television, Dr. Nelson-Hicks went to Asian Medical School, where she studied integrative medicine, herbology, and acupuncture. She then went to become a California State Board licensed medical professional and nationally certified herbologist and acupuncturist in clinical practice. She continued her studies and became certified in functional medicine. Always seeking ways to nurture her patients' health, Dr. Nelson-Hicks earned her doctorate in acupuncture and Chinese medicine. Her practice, Elixir Lifestyle Medicine, focuses on empowering and educating patients in natural ways to maintain wellness. Hi, Dr. Stacy.
Hi, thanks for inviting me.
Thanks for being here. I'd like to introduce you to Kimberly Wick. Kimberly is a licensed marriage and family therapist and holds a master's in clinical psychology and an MBA in international business. She is a former adjunct faculty member at Pepperdine University and in the Graduate School of Psychology. Trained in EMDR, Kimberly's experience as a trauma therapist brings a dimension to her work with individuals and families. Kimberly brings 20+ years of experience working with families whose loved ones suffer from debilitating mental health and addiction issues. Kimberly is a grateful member of Al-Anon for over 15 years and passionate about her own self-care and the benefits it brings to her everyday life. Kimberly has a love for the outdoors and is a certified equine therapist and avid animal lover. Hi, Kimberly.
Hi.
Thank you for letting me nice to see you here. Thank you for letting me butcher your bio. I'm sorry. Lyle Wick. Lyle, everybody, Lyle is here with us today. Lyle has an extensive experience in the addiction and mental health fields. Lyle's personal journey in recovery, education, and work experience gives her the rare ability to provide clients with clinical savvy and personal empathy. She is a certified alcohol drug counselor, has a BA in psychology from Cal Lutheran, and an MA in clinical psychology from Pepperdine. In 2018, Lyle founded Bridge the Gap Services, a therapeutic mentoring company that supports individuals and their families who are in the trenches with mental health and addiction. Hi, Lyle.
Hi, thanks for having me.
Thank you for being here. So tonight, to inform and inspire our discussion, we will first watch a powerful short interview outlining a family's experience with opioid abuse and addiction. Sit back, the video is about 10 minutes long, and we'll be back after to discuss the themes of the video.
Jim was a wacky, zany, and eclectic person. I mean, if you look around right now, these are all of his books, and then there's boxes and boxes of more of his stuff. So he definitely collected a lot of stuff, and a lot of interesting stuff too. He was a magician. Ta-da! He was a musician. There's boxes of guitars that he made out of cigar boxes. He made a whole bunch of these, and they have like input too. I think, actually, hold on, let me plug it into an amp and see if it still works. Yeah. Besides those interests, he was a genuine, caring, thoughtful person. He was just very sweet and fun to be around. When Jim died, I was 16 or 17. I'd come home from school, and my mom brought me into my room, and she said, "I need to talk to you." And I was like, "Oh boy, I'm in trouble. What did I do this time?" And then she didn't wait. She just said, Jim killed himself, and it was, I went from thinking that I was in trouble and being defensive to just like, I felt like nothing for a second. Like I didn't know how to respond, and it took like an hour, and it took me going on Facebook and writing messages to him for me to like feel like something had happened. I knew Jim before he was taking any medication. Ever since I knew him, he was always obsessive, because of his disorder, OCD. So I think the underlying factors for that addiction were there. He was also obsessed with our dogs too. He would take care of them religiously, and he would think about them all the time. But he was walking our dog, and he fell, and he was injured, so he hurt his back, and that's how he was prescribed the medication. Before his injury, he was prescribed Xanax so he could go on planes. And so I knew Jim had Xanax, and I knew that he would get, tired and a little loopy when he was on them. It would never raise any flags when I would see him taking medication. This addiction that he had, especially when he started using opioids, wasn't like I see someone, I see needles all over the ground or in the bathroom, or, I see him conked out in a gutter. It all seemed very sterile, and it's really strange to think about too, is like how he could have been pretty much doing drugs a room over from me, and I wouldn't even know. Even if I saw him doing it, I wouldn't even know. And then that's the problem too, that opioids, after you start using them and you don't have them anymore, you go to other things. He tried to buy Bitcoin so that he could buy other drugs off the internet, so he could buy like morphine or heroin or something off the internet. He went from being a socially acceptable addict to being a non-socially acceptable addict, getting his drugs from the doctor's office versus getting his drugs from the dark web. It's just interesting where the line is. An appropriate addict who can still, wear a suit and go to work versus a junkie who's in the gutter. Like, where's the line really? It cost $1 to see The Strange Thing, and for the first time ever, this is going to be seen on camera. So I'm going to take the liberty to do this. So I think I'm going to carry the name on. So $1 to see The Strange Thing. Are you ready? Can't look at it for too long. This is so cool. Okay, so my mom and Jim would put on a performance called a seance, and there's this old house in Ventura where we live. My mom would pretend to be a medium, and these people would tour through and like see this house where someone died. And Jim and my mom created like fake newspaper clippings and like had like Ouija board stuff happen. It's a really cool performance, Jim and my mom did a lot of really cool things like that. They did seances and flea circuses and improv performances, and I'm so sorry to have someone like Jim be taken like that, because he was definitely a blessing on the world. Definitely a big shining star. It's quite strange. So that's just one of the things that Jim had. He just had that. With addiction, your personality starts to change, so it felt like he was spiraling out of control. He seemed to be a very calm and rational person before, and he was, one of the smartest guys and coolest guys I'd ever known. And then that sort of kookiness and eclecticness of his personality started to fade, and he would become irritable or depressed. I didn't want to be around him. I would separate myself from him or not talk to him when he was around the house, because I was, either scared to talk to him or I had other stuff going on. Like, the change sort of happened. It's like I didn't see it happen, and then all of a sudden he was gone. Like, not only is this person I knew when I was a kid, this person who was like my dad, who was like my best friend, wasn't in there anymore, and then he was gone for real. So, yeah, the change happened without me really seeing it. Opioid addiction was part of the reason that Jim was asked to move out, but there were some other factors too. He was hard to get along with in that last year, pretty much, with my sister and my mom and myself and my older brother. And I remember this one time we got into an argument about something, and I walked away, and he threw a water bottle at me, and it missed and sailed into my room. And I was like, wow, what the hell? I kind of just felt like, oh, here it goes again. My parents are getting divorced again. It was hard to engage with his personal struggle. He had a spending addiction as well. He would go online and buy hundreds and hundreds of comic books or figures or magic gear, which we still have boxes and boxes of stuff that he didn't even open. I think the decision that my mom made to separate him from us was one of safety too, because he would get angry and he would get aggressive. He was not living with us, and that was for a multitude of reasons. I've never suffered from an addiction. Both my biological father and my stepfather have suffered from addictions, and one of them is still alive, and I think part of that is because of the willingness to accept resources and accept help. Jim wouldn't accept help, and he wouldn't go to therapy. He would skip therapy sessions, or he would refuse to go to rehab. So the willingness to accept help and to swallow your pride and to accept that you have a problem, that is the first step in conquering your addiction. And advice for someone who is in my situation, someone who has to watch someone they love suffer from addiction, it's, you have to be strong too, and don't feel like you're not the one suffering, because you're suffering too. So accept your suffering and offer help as best you can, but take care of yourself too. I mean, after suicide, it's hard to articulate your emotions. It's like such a wave of different emotions, And I felt guilty for a long time to say that I was relieved or that I was angry, right? Feeling anything other than sad, I felt ashamed. It was taking a toll on my mom. And I just really felt bad for my mom. And after his passing, feeling some sort of relief that he would no longer be putting a drain on her, at least for me personally, it felt a bit like a blessing, and I felt guilty to feel that. Maybe my mom felt it too. After his suicide, that's when things started to get a little easier, because with addiction, it's a whole strain on the whole family. I remember hearing from my brother that he had confiscated a gun from Jim, and my first thought when I heard that was that, oh, is he going to kill us? And then later, after his suicide, I was like, oh, that's what it was for? I mean, he didn't use a gun to kill himself, but that's why he got a gun, or maybe that's why he had a gun nearby. So it was just every day there was something new, and not having to worry about it anymore was, tragic, but it's like we could finally breathe. I feel like maybe I'm feeling a little unsatisfied and unconcluded because we haven't come to some grand conclusion about opioids or how to save the day, and that's sort of the problem about opioids, is that it's so big. It's a part of our culture, and I'm feeling like there's no simple answer to how to solve this. I wish things had gone differently, and I wish that Jim was able to be that person that I knew growing up. Even before his passing, it seemed like he was gone already. Even the annoying things, like him having to lock all the doors 5 times, and that we were always late, no matter where we were going. Even the little annoying things like that, like I would take those all back just to have my friend again, my dad.
All right. Thank you. Thank you. Thank you for watching, to our viewers, and thank you for the courage and honesty and vulnerability and guts and love it took to share that story to everybody involved. Which brings me to you, Catherine. Can I ask what your involvement in this story was?
Jim was my husband, and I'm pretty proud to be Mitch's mom. I thought that was really great way to share, and well, that's kind of hard to respond to. First of all, Mitch, how could you show our garage like that? How embarrassing! But
I'm like,
I do have a lot of magic things for sale, really great magic books and collections of things that we might be ready to let go of. But I just really loved what you shared about how special Jim was also.
Thank you. Thank you for letting us be in your space and tell your story. And I'm dying to see what the strange thing was. I don't know about you, but
you didn't pay your dollar yet.
I didn't pay my dollar. Catherine, I want to ask, as you were navigating the opioid addiction in your family, what kind of support did you want or need?
Well, I wish that I had known more about resources. We did have insurance, so we were, trying to get treatment. We had therapists, we had psychiatrists, and it was, we'd go in and he would go in and out of going through treatment and titrating off of opioids, and then somehow managing to get a whole nother 200 pills prescription. So, it would have been great. I think that doctors and pharmacists are being a lot more careful about that. But this was 2015, and I think things were really spiking around opioids. So, but also one of the things I think about is that I wish that there was more community discussion going on about it so that more of his friends knew, because I was trying to ask for support. I was trying to say, yeah, I think he stole those pills from your medicine cabinet. And people who knew Jim couldn't imagine that. So they don't understand addiction. They don't understand opioids. They don't understand how common that is. So when I would try to go to them for support and talk about it, it just didn't make sense. So I think if there's more community discussion like this, that will be helpful. And then, friends were even giving him pills. Like some friends were giving them his pills, or someone who lived in Singapore would get some for him. So I just think, had they really understood how serious this was, that there might have been a lot of other people in Jim's life that could have supported him in getting over the addiction.
Absolutely. Thank you for sharing that. Catherine's son, Mitch, who is in the video, he's actually the person doing the live stream here today. So I'm checking in with him to see if we might be able to introduce him onto screen, and we'll come. Oh, here's Mitch.
Hey.
Hi, Mitch.
I thought I was part of the discussion. I didn't mean to jump in front of Catherine, but my mom. Hi, mom. Hi, mom.
No.
Yeah, less red hair than that video, but hi. I'd love to be a part of this discussion.
Thank you. How did it feel to share that story in such a format with people watching and then sharing it out like this?
Well, we've shared this video a dozen times, and having it sort of in this live space felt a little strange, because I knew people were watching it, and not just like I send them the link and then they watch it. So definitely, of course, noticed like my mismatched socks, and then got some feelings in my gut about the situation. But thank you all for watching and letting me be vulnerable in a sort of disconnected way, so I don't actually have to tell the whole story again right now, because I might start crying. So,
Mitch, that was actually the first time I met you, was when we shot that.
In person, yeah, we shot that.
Yeah. I would love to bring our panelists in an open discussion around willingness to get help, since I do think that all of our panelists can speak so awesomely to this idea. We have Ashley in the chat. It's okay if it can't get on the screen, Mitch. I know you're trying to be many jobs at once here, so we can just focus on the convo. Ashley is asking, thank you for speaking to such an important topic. Willingness to accept help seems big when it comes to recovery. How can a person encourage a loved one to get help without being too heavy-handed with it? And I do want to open that question to anyone who would like to speak to that.
I'm happy to comment on that. So as a therapist, I would say you have to focus on what you can control and let go of what you can't control. It's really important that we focus on ourselves. It's challenging to encourage a loved one to get help that's not ready yet. And so by setting our own healthy boundaries, it lets our loved ones experience life on life's terms. And of course, that's different if we're a parent of somebody who's under 18 versus a young adult versus a spouse. On a personal level, having been married to an alcoholic and him not getting into treatment until after I had asked him to leave, and this is my daughter Lyle, and her father was an alcoholic, it was really challenging because it's unimaginable that our loved ones would die or have their lives come crashing down. So no matter what our profession, even as a therapist, I found myself desperately trying to fix and save him. And it wasn't until I got my own help that I learned to detach with love versus detaching with anger. When it comes to our young adults, Lyle was in her addiction when she was 18 and is 11 years sober now and also a therapist. I really had to learn to let go of the outcome and the result and know that I really had to focus on myself because it felt very different with my daughter than it did with my ex-husband, that the whole road of trying to help.
Yeah, and I'll just add to that that I think, being on the other side as the person needing to get help, it was so helpful for me when my mom set her boundary and made clear, hey, I'm not comfortable with you doing this. I'm not going to support you doing this. I love you too much and I need to take care of myself. By hearing that and having her stick to that, it really allowed me to get uncomfortable and get to where I needed to get to become willing and accept help. And although that's not the story with everyone, not everyone gets to a place of willingness or has the opportunity to. But I will say that I think the loved ones sticking to their grounds and keeping the focus on themselves and doing what they need to do for their own self-care really allows the person who's struggling to have to stand on their own 2 feet and take a look in the mirror and not be enabled. And hopefully that then prompts them to do what they need to do to take care of themselves.
And I would just like to add on
Yeah.
one quick thing to that, because it was not quite that neat and tidy.
No.
But I'll tell you that I basically had an exorcism in our living room one night when Lyle relapsed, and honestly, anger was my best friend, because there's good anger and there's destructive anger, but the anger was what gave me the courage to get out of my house. If you're not going to get willing to be willing and take this seriously, I don't want you in my home. And I'm not suggesting that other parents kick their kids out of the house, but for me, I had already been through this with my spouse and now freaking out about my daughter and her lack of willingness. And for me, somehow Lyle was able to know, wow, mom's never done this before. She's really seriously. And I remember you saying that was actually what reached you.
Yeah, definitely.
It somehow, my anger snuck in there and made her get the levity of the situation. So it's challenging, Catherine.
Well, I just wanted to, you bring up something that I want to kind of say in relation to Jim's story that it relates to that. And that is that, when you're pulling away, when you're saying, sorry, you can't live here if you're going to act that way, part of our concern was like, are they going to commit suicide, right? So there's that, like, do I push them too far? Am I responsible for the suicide because I set those boundaries? And what I've really come to understand, and a really big factor in this, Jim was doing better. We spent the day together before his suicide, and it was that he got back on. He titrated off opioids. He was able to get a bunch more, and from the pharmacy, and then they wouldn't let him titrate off. And so the suicide had more to do with this extreme withdrawals. It's just in so much pain from withdrawals. And I don't think the suicide was because we had made him move out. Because I know that's a fear, right? To set those boundaries. Oh dear, what's going to happen if I'm, and so I just wanted to clarify that that's really what I think about his story.
That's such an important point, because people, when people play the suicide card, and I don't say that lightly whatsoever, but I've helped a lot of families where teens will threaten suicide, or young adults, or even adults, grown adults. And it's so challenging for the loved ones to set those boundaries, because the fear of losing their loved ones is incomprehensible. But at the same time, we can't control it. There's a saying, I don't want to love my loved ones to death. And by not taking care of our own needs and ourselves and offering resources, it's look, it's a brutal disease. There's no two ways about it, and nothing's easy about it. But at the end of the day, I really believe we have to take care of ourselves.
Thank you so much, both of you, for coming on here too, and sharing your story and the growth that came from that. I mean, you're both so amazing, and I'm happy that you guys are here to be a part of our connection.
Thank you so much. We are too.
We're happy to be here.
Really, really honored.
Yeah, humbled and really honored, and grateful to have the opportunity.
Thank you. I want to get Dr. Stacy back in here, and I want to run something by you, Dr. Stacy. We haven't seen enough of each other so far today. I was talking to my good friend Adam, who became a doctor on Tuesday, and he was telling. I'll pass it along to him. It's very cool. He was telling me that I was telling him about you and your special area of practices, and this conversation we're having tonight about opioids. And he said, opioids have a place in medicine. We have to use them for immediate pain, like post-op periods, but for long-term chronic pain, what are other alternatives out there that you think might be effective, that are underutilized, or just not given by doctors or other practitioners?
Sure. So as an acupuncturist, I am going to be biased. Acupuncture is amazing for pain relief. In fact, there is a hospital, I think it is in Maryland, who has just started a program where they have doctors of acupuncture and Chinese medicine and licensed acupuncturists in the emergency room. And they find that the patients who come in who are treated with acupuncture don't need the emergency room services as frequently as they would have without it. And they're finding that they can use fewer drugs on those patients as well, and get them out of the ER sooner than having to get them into a bed in the hospital. So that's really overlooked in most hospitals, especially. So of course, for post-surgical pain, you want people to be comfortable, because if they're not comfortable, they're not going to heal. A great idea is to have acupuncturists on staff in the hospitals, so that post-surgically patients can be treated with different type of needles, our needles, and electrostimulation, and just a sense of touch. And that has been shown to lower the use of drugs, the amount of drugs that people have to take while they're in the hospital. Of course, you want that to continue when they're out of the hospital, and people can come in for treatments for that. We have herbs that we use quite a lot for pain. Chinese herbology is very different than Western herbology, and it's a very personalized medicine. So we use our diagnostic techniques and figure out which herbal formulas would be right for you, and have you take those 2 to 3 times a day. In China, acupuncturists are just on staff in all the hospitals, and you're going to get combined care when you're there. And there are very few hospitals that are doing that in the United States now, and hopefully that will become a trend, so that we can nip this in the bud before people actually develop an addiction to these medications, as we all know are so easily done. And to the point that was made before about patients putting up boundaries, or family members. I treat, I actually see more people who are family members of the people with the addictions. And I actually treat these people, it's very different in Chinese medicine. I combine Western medicine, this functional medicine, which is nutritional and supplement based and dietary based, with traditional Chinese medicine. And traditional Chinese medicine works on the whole person. We are a holistic medicine, so we are treating mind, body, and spirit really in one treatment. And there are treatments that I do for patients who have family type issues like this, where we actually can help build boundaries for these people, where we can touch the emotional part of that, where we're strengthening their resolve. And that's a beautiful thing to do for these patients, because we all know how difficult it is to be on the other side of that and having to deal with and help people you love. And I try to support my patients who have these family dynamics that way.
Thank you for sharing that. I hope as a society we get there too, right? We can walk into an ER and get acupuncture. And
it would be wonderful. Or even if you're not at the ER, even if hopefully your friend Adam will refer to us, because a lot of people still feel like they need a referral. They don't know what we do. They don't know what our qualifications are. And if an MD or a DO or a therapist says, you might want to use this as well, I think that puts people onto us sooner than thinking of us as a last resort. Like, I've tried everything, now I'm coming to you. And we do see that with, occasionally people will think of my practice if they're having addiction issues. And as you said before, that I find that people have to really be ready to change. You can't just come in and have me put a needle in you and then walk out and be, okay, I'm done. It's a process that we go through. But if the patient is ready, acupuncture and Chinese medicine really do help calm cravings. They help with withdrawal syndrome. So we're there in that realm as well.
thank you. And hearing the stigma involved in that you were describing about acupuncture, it made me think of how so much of life is kind of pushing against stigmas. And there's a question here in our stream that says, we really appreciate what you're addressing here today. Question for everyone: what is the stigma toward opioid use and why does it exist? So if any of our panelists would like to speak to this, what stigmas are around opioid use?
I can speak a little bit to that. I think it's really tough. I think there are stigmas related to opioid use and all forms of addiction. I think that goes really far back to, growing up. My idea of an alcoholic or a drug addict was someone under a bridge, who lived under a bridge and didn't have a job and was homeless. And moving forward, obviously my lens changed as I had experience with my dad's addiction and then my own addiction, and having worked with addiction now, seeing executives and people who are really high functioning who are struggling with an addiction at their home. I think there's a lot of shame surrounding addiction because oftentimes I've heard it compared to it's like someone sick with diabetes, something that they can't control. And I think that there's a lot of shame associated with addiction too, because a lot of the behaviors aren't socially acceptable. So if someone's using opioids, oftentimes symptoms of that or behaviors they engage in to get their fix and to feed the addiction is stealing money to get the drugs, or doing things that aren't socially acceptable. And so I think there's a big stigma related to that because there's so much shame surrounding that. And that can go into shame from family members of if they've enabled it at any point. And that shame really fuels the fire and builds this stigma. And I think also there's stigma from a lack of knowledge and a lack of understanding of what really is this. You know, it's not just someone who maybe likes to steal or act out in certain ways that many people don't find appropriate. It's that someone's really struggling and they've developed this thing for whatever reason. Maybe they turned to it because they couldn't cope with something challenging going on, or it's genetic or whatever it may be. But all of a sudden they're in the throes of an opioid addiction, and it's hard to talk about, you know, and it's hard to admit. And I think it's that shame and lack of knowledge oftentimes. So
Yeah, I'd like to speak a little bit to that, and maybe this is the opposite of stigma. But I know that, you know, there's people like Jim that start taking pills because of surgery or pain, and then they get addicted, and then, you know, but there seems to be this sort of idea that that it's no big deal to take a prescription drug. I mean, we work with high school students, and know from conversations and focus groups that, you know, young people can buy them from each other, and you know, that they're party drugs sometimes now. And I think because they're, you know, prescriptions, a lot of the time somehow there doesn't seem to be as huge of a stigma around it as I was imagine there would, that somehow it doesn't feel like doing drugs in the same way as maybe illegal drugs, but you know, using them improperly is illegal. And so I just wanted to, you know, bring up that side of opioid misuse, that it's also used recreationally, regardless of pain.
And Lyle, there's something you said that I really resonated with, that I even talked about in the video and the interview, is like when we think of addiction, we think of it as under a bridge or in a gutter, right? Especially for me, when I was like growing up in high school, that's how we see addiction depicted. But like Catherine mentioned, like you mentioned, addiction and use of opioids can range from like that sort of addiction, or recreationally at parties, or a family member that's hiding it so well. Um, and so just what we consider addiction to look like can really just vary so much.
yeah, and I think that's a really good point, that addiction is so on a spectrum, just as pretty much everything is that we've come to learn. And I think what can be helpful too is like seeing the signs of, okay, you got prescribed this opiate post surgery, and you know, what are the warning signs? What can that really take on? Because I think so many people don't think it could happen to them or their loved one. And just like you shared, Mitchell, about Jim and your experience, and you know his friends didn't think that would ever happen, right? He would never take pills from us. So I think, yeah, it's really important.
Yeah, and Catherine, my mom can definitely speak more to that, because from my perspective, I was dealing with high school and whatever drama a 15, 16, 17-year-old deals with, while she was dealing with the brunt of Jim's addiction and the everything that comes along with that. So I don't know, Catherine, we've talked a lot about this, but I'd love to hear more about what was going on with Jim at the times when I was worried about, track and field and girls and stuff like that in high school.
Well, I guess I'd just say that, you know, it became addiction to many different things. Like, I think that's how addiction kind of is. I mean, I don't have a lot of experience with addiction in my life, but, you know, like you were mentioned in the video about him buying all these things and getting into Bitcoins, a lot of that became as a way of trying to get money to get pills. So I think maybe the signs of, you know, watching the change in behavior, the sweetest, kindest, funniest, man we knew, was behaving in such different ways. And I think he was pretty deep into it before we had any idea. I found something on a phone once that made me go, what? And then we could see it. So I think knowing the signs, I think Lyle mentioned that earlier, for people to know the signs, and that there's a lot involved in addiction besides just taking the pills, like the change in the behavior, the change in personality, always sleeping. And so that's part of what I think is one of the things that is helpful, is just being able to have conversations. If it becomes more knowledge, just and more easy to talk about, right? I think a lot of times opioid addiction is happening to people that are in communities that are affluent and that are not as willing to talk about problems in their family. I notice we work throughout Ventura County, and there's places where, maybe a more humble community is willing to talk about their problems and their issues. And then in other communities, it's like everybody has this reputation and this image to uphold, and they're not as willing to ask for help or to admit that there's any kind of problem. And so the stigma around talking about it and being open about what's happening, I think is in the way of helping.
And I want to add something for the family members whose loved ones have opioid addiction or any other kind of addiction, because we look at what are the signs for our loved ones who might be struggling with taking substances. But the signs for us is that we start walking on eggshells. We start becoming afraid of conflict and if our loved one's going to react. We start altering the way we behave, trying to manipulate outcomes. And I find that with a lot of people, these behaviors happen before we're clear that there's a problem, a real problem. It might be that the relationship's going through a rough time. And also for a lot of people, and maybe not everyone's story, but there are little threads of common denominators that just get larger in the addiction. It's not often where someone goes from where everything's absolutely perfect to all of a sudden they go from yellow to orange. In some cases, when there's a medical situation and then there's an addiction because of having to take those substances for pain management, that can be the case. But in the case of someone becoming addicted to opioids because they've been partying or tripped on that because they like to have their beer or wine or cocktails and then smoked a little pot and then tripped onto opioids, usually there's some kind of slow progression. And for me, I'm always in working with the family members, always wanting to know what are their symptoms. Because again, taking it back to, we can only control ourselves. We can't control people, places, or things. How am I doing? How am I landing? What am I feeling like? And if I don't let fear be my compass, how might I learn some languaging skills so that I can be in my own skin and honor myself and not enable what's going on in my home?
Absolutely. When I think of opioids, when I hear you all talking about the opioid problem and the opioid addiction, when I peel back the layers, it seems like it's all stemming from pain and pain management and something that's handed to you to get rid of your pain. And I wonder if Dr. Stacy can talk to us a bit about what massage might do for pain in other areas that are not as mainstream, that really do wonders for pain management for long-term chronically ill.
One of the things that I refer my patients to, because I think it works in conjunction with the work that I do. I do a lot of orthopedic style acupuncture when necessary, and I also do the emotional and spiritual, more traditional side of acupuncture. But neurofeedback is something that I refer my patients to quite often. It's also known as EEG. And there are several practitioners in my area that I can refer to. And basically what it does is it helps modulate your brain waves. I don't practice it myself. I think it's awesome and I would love to. But basically you're playing a computer game with your brain. So you're watching a computer screen while there are electrodes monitoring your brain activity. And then the practitioner is actually modulating the screen as you're playing. And so it gets your brain waves back into the parameters where they belong. And you don't even have to talk. It's not even talk therapy, which some people, which I love, but some people are talked out or don't want to rehash their problem. And you just sit there and play this game and your brain, you're modulating your brain as it's being modulated. And it is really fantastic for emotional pain and for physical pain. There are more esoteric modalities out there. Some people have really good success with Reiki, which is kind of an energetic treatment. I am a huge fan of chiropractic. I think chiropractic is amazing. I think physical therapy is really important. And I have a very good colleague who is a doctor of physical therapy. And we were talking yesterday, and he said there were some studies that had just come out of Australia via a surgeon who was doing the research, who said that most surgeries, most orthopedic surgeries fail after several years. So you might get some relief for a little while, and then you're going to have new pain around the area that the surgery site was, which I see constantly because I can't tell you how many patients I have who are back surgery or neck surgery patients who are still my patients or discover me after their surgeries have failed. So the idea is to prevent the surgery in the first place if we can. Obviously, if you need surgery, and your arm is falling off, yes, it needs to be sewn back on. But if there is a pain that we can use, chiropractic, acupuncture, physical therapy, neurofeedback, then perhaps we can prevent all of this. The other side of things that I'd like to talk about are neurotransmitters, right? I mean, that's what people are trying to fix when they are experimenting with drugs. So there are certain tests that can show us what's going on with certain chemicals in your body and which may be out of balance that can lead you to have cravings. And then we can work with that with supplements and with dietary means. Most people will need supplements depending upon where they're at, that can actually help balance your brain. So I like to hit that hopefully before anybody discovers anything else. If we can get to the root cause of why people are in such psychic pain or emotional pain, and work with things that are not prescription that you can find at the grocery store, the health food store. I think prevention is what I like to practice. And if I need to come in and do actual treatment, on pain, emotional or physical, then we're there for that too.
Thank you. It's so
Sure.
interesting. I want to just talk to you a lot more. I want to talk to all of you a lot more, to be honest. We have a new question here on Facebook that I think we can get up on the screen. It says, what are ways to help a person that admits they relapsed and want help? How can we help somebody who relapsed?
Well,
I'm happy to start off. I think one, that's so awesome if someone's able to say, I relapsed and I want help. That is huge. There's a lot of different ways. There's incredible 12-step programs to connect them with. That could be AA, Alcoholics Anonymous, Narcotics Anonymous. there are really incredible treatment programs now if they feel like they need a little additional support, whether it's with therapy. Obviously, there's acupuncture. I did neurofeedback and it changed my life. So
Great.
yeah, I'm really big on that as well. And I think it's also okay to say, how can I support you? You know, to ask, not feel the pressure to know the answer, but to just say, what can I do to support you through this, and brainstorm together. And obviously there are different hotlines and therapists and hopefully doctors too that you can reach out to for that support as well.
And just to add on, I think when a loved one hears I relapsed, it's really common to freak out and get scared because you might feel like you're starting from ground zero. And I have really encouraged my clients, and this is from my own practice too, is I'm really sorry. Because the person that's relapsing is struggling and in a lot of pain. And so I think that being able to say, I'm really sorry, this is such a struggle, is a way to separate out, not for us to not own the problem, because I believe that somebody who can come in and say, I've relapsed, is already on the road to recovery.
Mm-hmm.
And for that person to fully be able to really own their own recovery, because that's when recovery has the highest chance of success, is the person in recovery is owning it. By the way, family members are in recovery. We are all in recovery. This is a family disease. I believe it's really important as family members or friends, whether it's a spouse or an adult child or a teenager, the first thing is, I'm so sorry, this is a struggle. And then, like Lyle said, there are different levels of care depending on what the needs are. Everything from residential to partial hospitalization program, which is 5 days a week, 6+ hours a day. Intensive outpatient, which is at least 3 days a week, 3 hours a day, down to outpatient, which is therapy, psychotherapy, 1 or 2 times a week for an hour. There's mentoring, which interfaces with all of the doctors and school counselors and therapists, and that's what Bridge the Gap does, is bridge the gap between the entire support tribe. And then there's 12-step programs, which are amazing. So there's a lot of help out there. I think people have a hard time sometimes knowing where to go to look for help. And a lot of times people are in crisis. So it's hard to find what you're looking for when you're in crisis. Sorry, that was a little long-winded for that one question, but I just wanted to comment on that.
Thank you. And it actually brings us to some of our closing thoughts and resources we do want to share since resources are coming up here. I'm going to ask Catherine about naloxone and to tell us a little bit more about that and what we should all know.
Yeah, I think, talking about relapse is a good segue into talking about naloxone. So naloxone, Narcan, it is a... It is an let me see, I wasn't practicing and preparing for how to say this, but it can reverse an overdose. And it's available to us in Ventura County for those who have loved ones or are working in places and situations where there might be people that are addicted. So it reverses an opioid overdose. So naloxone can reverse it. It doesn't, and save a life. So if someone has overdosed, the naloxone can reverse it for about a half an hour, I believe, and in time to get medical care. And it's a temporary thing, but it can save a life. And so we'll show you the website from Ventura County that will give you more information about that. But sometimes, overdose, we didn't talk much about overdose. And one of the reasons that overdose deaths happen is sometimes because someone who's been in recovery, and when they relapse, if they take even near to what they were taking when they had built up the tolerance, they're really in danger of dying from an overdose. And so it's good for family members. So there's more information on the website about how you can get that and have that on hand.
Thank you, Catherine. The website, we're going to end our presentation. I'm used to being in class. I've been in classes all day, KK. We're going to end our discussion in just a few minutes with a resource page. It is Ventura County responds.org is the place where you can go to get a overdose rescue kit is what they call it, and training on how to use that. But we're going to bring everybody back for this last moment, and I want to sincerely thank every one of you for being part of this discussion. I've never been part of a discussion like this. I think it's challenging, but so worth it and so important. And I want to ask for any closing remarks before we go into our resources and our have a good night. Mitch, can I start with you? I'm used to throwing you under the bus all day.
I just realized I was muted on the stream. Yeah, I just want to say that this has become so important, and it is so important. It's so important to me and to our communities to talk about opioids and to destigmatize and just bring it into our heads so that we can make significant change, and to have people like Dr. Stacy and Lyle and Kimberly and Bright, of course. I'm a little biased for Bright. I love Bright, but I'm so happy that there are people like all of you in the world to help this problem.
Thank you, Mitch. Kimberly and Lyle?
I just want to say I'm so honored to have been a part of this discussion because it's been such a journey, and it really is helpful to be able to help others. And I'm really, really honored to have been here tonight, especially with my daughter.
Yeah, me too. What you all are doing is incredible, and it's so needed, and I'm so grateful that I get to be on the other side in recovery and share what I've gone through to try and help other people. So I'm really, really grateful to be here with all of you.
Thank you.
Thanks for having me. Anything I can do to help, I'm happy to. I love to see people getting better and healing.
Catherine, anything you'd like to add?
I just want to say thank you all for being here. And I think it's so important just having these discussions. So Mitch, I love you. I'm so proud of you. And thank you, Victoria, for being such a lovely host for our BRITE Connections.
Thank you. Let's go hearts into resources, y'all. Hearts into resources.
Stacy doesn't quite know how to do that.
Not part of my vernacular. Let's go.
Bye, everybody. Thank you.
Bye. Thank you.